How does this handle, how does
I have a
this?
question. Is all of this a moot point if Obamacare doesn't get repealed?
No, because our budget anticipates a repeal of Obamacare. But here, here's the deal. We've repealed it, we've defunded it, we've done it. I mean, we've done all of that. But if you can't get it through the Senate, it's not going to happen.
Well, what about illegals and emergency medical care that people are using? How is that handled then?
Well,
Because that's a large part
I
of
can
it.
tell you, the abuse in emergency rooms, it is a problem. It is, I think there are several different approaches to that. One of them involves more rural care. For example, let's say there's somebody in Columbia County's got a hospital, but let's say there's somebody in Lafayette County who doesn't have, and there's no hospital nearby, and they get a cold. Well, a lot of rural Americans will just go to the emergency room. That's not an illegal abuse.
I've been
But
in there recently.
yeah, as you know, that is a huge problem because the price of going to an emergency room when they don't need it, they'd be better off at a clinic for a much, that's a huge part of our cost problem. But I won't say a huge part. I don't know what the percentage is. Ultimately, we've got to deal with
They don't keep
the
track
stuff
of it a
that
lot of times.
Yeah, I mean, some of that's hard to track. And that is why that I've been a big supporter of rural clinics. Even some of them that in some cases they get federal funding because that county may have nothing. And if it's get an ambulance and go to the hospital in the next county for thousands of dollars, or have them go in a clinic and get some,
Walmart announced they've
got the same
they're
business.
doing clinics
Yeah.
and they're keeping that open 7 days a
I've
week.
used them. They're good.
Yeah.
Yeah.
Yeah, and something like that is what I would like to see y'all support
Yeah.
for illegals and people who are not going to be insured.
Yeah.
Because I assume you're not going to force people to be insured under Ryan's plan.
Right. Well, under Ryan's plan, we're talking about Medicare.
Right.
This is not healthcare generally.
Yeah.
Healthcare generally, we have a lot of these ideas this gentleman raised.
Yeah.
I like to encourage innovative pooling, innovative pilot programs. Let's see what works and what doesn't. Let's have flexibility. I'm all for competition across state lines.
I've heard doctors say they would give a day if they got a tax break.
Yeah. Well, I can tell you what, if we keep discouraging people from becoming doctors, we're going to have
never
an even
have.
greater
Yeah, and that's what
problem,
they're doing.
because we already have a shortage.
Yeah.
And, I want my doctor, having spent 10 years or whatever in school, I want them to do well.
Yeah.
Yeah. On a similar note, Obama's trying to push another comprehensive immigration reform, which we all know is an amnesty, and too many Republicans have fallen for, if I pass some kind of path to legalization, free
There's not going to be
legalization.
any amnesty passed out.
Well, too many Republicans are, may end up
Trust
supporting
me,
it.
it ain't going to happen.
I have.
Well, I know, but-
We talk every day. I mean, the Senate's got their own thing going on. Like, we're here on District Work Week this week, and the Senate is up there working this week. So, we talk, we're friends, but, we're working on a lot of our own. Ultimately, he may vote for stuff over there that we passed, but we're not always working on stuff at the same time. Like last week was a big offshore drilling week for us. We were just passing stuff right and left. Well, who knows when we'll take that up in the Senate.